My name is Ksenia Bodden, and this is my final project on diabetes yesterday, today, and tomorrow. So let's dive in. Diabetes and its complications have a huge and growing impact on the United States. Just in between 2010 and 2020, the number of people living with diabetes tripled. So we know that adults with diabetes have 50% higher risk of death from any cause than adults without diabetes. That's pretty significant. So what is diabetes? Diabetes is a disease that affects your body's ability to produce or use insulin. So we have type 1 and type 2. Type 1 is when the pancreas does not produce insulin, and it's usually juvenile onset. And type 2 is when the body does not produce enough insulin, and that happens later on in life. So is it disease or epidemic? Well, diabetes is a chronic non-communicable disease. However, as we can see that the number of people with diabetes has been rising. So diabetes is a major public health problem that is approaching epidemic proportions globally. Let's dive in and talk a little bit about the history. Clinical symptoms similar to what is known as diabetes today were documented over 3,000 years ago by the Egyptians. The term diabetes was first coined by Aretas Cappadocia. He was a Greek physician between 30 and 90 AD. During the ancient times, knowledge of the disease was limited to a simple awareness of patients' symptoms such as thirst, polyuria, weight loss, and coma. However, back in 1500s, diabetes was documented as frequent urination that caused emancipation. People then believed that diabetes was a mysterious disease with these types of symptoms. Healers during that time noticed that ants were attracted to the urine of people who had this disease. Well, in 1600s, the word diabetes mellitus was defined as honey sweet because of the sweetness of urine and blood, and it was added by Thomas Willis, and it was later confirmed by Dobson in 1700s. However, later in the 1800s, doctors began noticing that dietary changes were helping manage diabetes. These led to the fad diets such as oat cure or starvation diet. However, controlling diabetes through the diet was not always possible during those times. It was also discovered that the pancreas played an important role in diabetes because when it was removed in dogs, it produced immediate diabetes. So, interestingly, Dr. Banting came up with the idea to use insulin to treat diabetes in 1920s, and here he is. So let's take a look at more recent history. As you can see in the 90s, just in 8 years, the prevalence of diabetes increased by 33%. And it was observed in both sexes, all ages, all ethnic groups, all education level, nearly all states. As you can see, the CDC did the study, and Native American, Blacks, Hispanic have a higher rate or percentage rate of diabetes, being affected by diabetes, as we noticed that part of the type 2 diabetes is excessive weight. So people are being stigmatized for being overweight, for having diabetes, for being from a low income, and it kind of piles up and being discriminated against just because of their medical condition. So let's take a look what is happening today. Well, today, thank you to Dr. Banting, we're still continuing to use insulin, and it's widespread. Patients now also have a new way to test their blood glucose level, and that's we have a personal meters at home. So overall, we have a better testing and earlier diagnosis. We have access to care for all people with diabetes, so at least we're working on that. Low income, as I mentioned earlier, being affected by that. Improvement quality of care, we're striving, and primary prevention. So let's look at treatment. We have different tests, so we don't need to use the ants anymore or taste the urine, but we have these tests, A1C test and random fasting and oral glucose blood sugar tests as well. We can also control the diabetes with diet like they did in the past. However, we also have medications like metformin and insulin. I found this interesting. I thought this was a pretty cool tool. It's a kind of like a live stream. You're able to not only detect the glucose, but also deliver a pump, and you can see it in a live real time. And the prevention's been huge. Now we know that smoking can cause diabetes, sugar drink, not exercising, and all of that. This is something we didn't know back in the day, but we do now. So let's take a look at the future. Ironically, it's still projected that the increase will continue by 54% to more than 55 million people between 15 and 30 years. And also, 1 in 3 people will have type 2 diabetes by 2050 if we continue with the current trends as they are. So let's take a look at a quick map. We have from 2000 to 2030. As you see all over the world, diabetes continues to increase in people. So is this an epidemic? I would say it is. Is there a cure? What do you guys think? Well, there's a search for cure. Cell therapy is one of the biggest hopes toward developing a cure for diabetes. And what it is basically replacing the missing insulin producing cells. Basically, can potentially recover normal insulin production and cure patients. And that is the hope. We also have bioengineering mini organ, and the hopes there that the patients will no longer require insulin therapy. Immunotherapy is one of the other ones, and there's a bunch of others that we hope to develop. I'm excited about these nanorobots that would travel into the bloodstream while continuously measure the glucose, and it also can deliver insulin right to the source. I thought those were pretty cute. So also the microchip that would diagnose type 1 diabetes before symptoms will appear. That is all in the future. Very excited. Well, this is me. I'm a firefighter. This is my friend John. He's a driver engineer, and he's been recently diagnosed with diabetes. I just want to leave you with that. I just want to say that this societal view of people affected by diabetes can cause harm by disregarding the issue and preventing people from seeking proper diagnosis and treatment. You see, I think the education is the best way to deal with social perceptions. That is the biggest change that has been happening in the past several years. We're progressing. People have been becoming more aware of diabetes and mental burden that comes with it. But as a society, we still have a long way to go. I think it is so important not to be ignorant and be open to understanding and supporting people who live with diabetes. This is the reason I chose to do my presentation diabetes, because of my friend. And here are my references that you can take a look at. But I wanted to guys say thank you, and I hope you enjoyed it and got a little bit of information about this disease. Obviously, I've learned it on a personal level. It's personal to me, and I hope you enjoyed it. Thank you very much.